So we're going to move right into our next session on the impact of shared value on partnerships and other stakeholders, and I'll invite Beth Bafford from the Calvert Foundation to lead that panel.
Good morning, everyone. Pick up the common thread. I'm also a Blue Devil, so pick up the common thread from Dr. Zhao.
That makes three.
Yes, Wendy's also. We had a good game this week, so everybody's happy. All right. So my name is Beth Bafford. I'm a director of investments at the Calvert Foundation. Just to clarify, because it's confusing, Calvert Foundation is a bit of a unique organization. We're not Calvert Investments that some people might know, which is a mutual fund company. And we're not a foundation. We're a social investment fund or an impact investor. And we raise and deploy debt capital into community and economic development in the U.S. and around the world. And one of those, the sectors of our focus and of my focus, is global health that we've been exploring for the past couple of years. And so really excited to have this conversation today to talk about how kind of corporate shared value strategies are intersecting with impact investing, with government, with philanthropy, with social enterprise, and with NGOs, and talk about how, what we've learned from relationships with corporates, what lessons we will take to the field, what opportunities we see in the future, and what challenges have come up. So, before we turn to our esteemed panel, everybody's bios are in your booklets, but we'll introduce them in a second. Just wanted to talk a little bit about how our sector, the impact investment sector, is intersecting with corporations in the area of global health. And so last year, I did a landscaping, actually, with the help of the folks at IPIHD and Duke and USAID. We did a landscaping of global health investments mostly in sub-Saharan Africa and India, and really looking to understand what was going on in the sector, what the opportunities were, and how Calvert Foundation could develop a portfolio strategy to invest more actively in the sector. And there were really three things that I think were pertinent to the conversation today that we learned through our conversations with about 40 fund managers in the space. One is that there's really a dearth of capital available that is disease and population agnostic. So there's been a lot of donor funding and funders who are focused on a specific disease, so TB, malaria, HIV/AIDS, or a very specific population, rural, poor, maternal child health, which has left a need for more flexible capital that's really investing in infrastructure, investing in the clinics and the hospital systems and the pharmacy chains and the things that are really the avenue for which the services and technologies are delivered. Two is that there's a lack of sufficient human capital at the intersection between business and health. So there's a lot of medical professionals, there are business folks, but there's not a lot of people who have both skills, who can really run and build and scale global health companies, enterprises, and innovations in developing countries. And three, that the public sector is really eager to welcome the private investment and private sector activity, and really looking for leadership from the private sector, because there is a increasing recognition that they cannot provide health services alone to their populations. And when I say the public sector, I'm saying in-country governments. And so all three of these trends, I think, really point to a welcoming ecosystem for more corporate engagement. One, corporations can bring more of that flexible capital to really build infrastructure. I think it's both needed in the sector and it's also necessary for their future growth. Two is that they can really use their corporations can use their human capital to train and mentor entrepreneurs and medical professionals to grow and run businesses successfully. And lastly, that their investment is really welcomed, that it's not the public sector will be open to more of that engagement, to bring in private investment and a private sector mindset to developing more robust health systems in low and middle income countries. And so as an impact investor, I'm very excited about these corporate partnerships, and we've started to develop some and look forward to developing more, because I really think that they can be extremely strong partners for private investors and for partnering with all of the organizations that are represented on the panel here today. So with that background, I thought I would pass it along to our panelists. I'm going to ask each of them to talk a little bit about their work and answer some questions about how they've engaged with corporate shared value strategies. And then we'll open it up to questions and have a discussion with all of you. So get your questions ready.